So being out in the lecture circuit and speaking with other dentists at conferences and such, I hear two major concerns surrounding the myths of the NTI appliance. And the first myth that I hear is a concern about aspiration or swallowing the appliance. Now, I can tell you that with the hundreds of thousands and possibly millions of appliances that have been placed and fabricated worldwide over the years, there's been zero radiographic confirmation of an aspiration or a swallowing of the appliance. Now, a lot of dentists are concerned about the small appearance of the appliance and how tiny that it is. Now, I'll tell you that I view that as a positive because, patients are more compliant with wearing the appliance because it's small and it's comfortable. They don't have a very obtuse appliance that's large and covering the arch. If the patient doesn't wear it for a day or two, full arch appliances, I know they have a problem with trying to put them back in place with shifting teeth or just with acrylic shrinkage versus an NTI, which is very small and it's a lot easier for the patient to wear, so it's more comfortable. So I can say the first myth of aspirations or swallowing is definitely busted because there is no recorded or radiographic confirmed recordings of an aspiration or swallowing the appliance. Now, the second myth that I hear many dentists confirmed about is the cause of an anterior open bite with the appliance. Now, I can tell you that I've seen patients, maybe one patient over the years, where they went from a centric relation posture and centric occlusion where they can get their teeth together, where they had a hard time in the morning of getting their teeth all to meet properly. And the reason why this happens is because of its elongation of the lateral pterygoid. So it's not a problem with the appliance itself, it's the fact that the patient in general, why they have pain, why they have issues, is because their bite is the way it is, and the NTI only helps bring that to the surface. Now, how you can protect yourself, because if you're looking at it, well, how do I know if this is going to happen? How do I screen my patients? It's very simple. You can take a leaf gauge in your office, and you can put this in place. You can dial up as many leaves as required to disclude the posterior teeth, and you can see which tooth touches first and bring that to place. Now, what you can do is take a photograph of that leaf, or just record that. Let the patient see that. And then you can say, worst case scenario, what may happen is we're going to take you from a point in time where your muscles, painful and having problems getting your teeth together, we're going to get rid of that pain. We are going to put your muscles back to the way they were before, and we're going to bring your bite out, and it's going to show you where your bite is. And it's here, right where this appliance is in place. Once patients understand that, there should be zero problems with acceptance and patients understanding it. Now, I can tell you that I've heard stories of people saying they have a lot of people who have anterior open bites, or a lot of people this, and have their concerns about their bite relationship. Now, I can tell you, in my opinion, those are people who are pain and migraine patients to begin with, and who are now, once they're wearing the appliance, they're pain-free and they're asymptomatic. If they have a 1 millimeter anterior open bite, I would tell a dentist, stop being so concerned. The patient's not concerned about it. If they can function, they're absolutely fine, and they're pain-free. If they're not concerned about it, you shouldn't be concerned about it either. If they want, you can take a study mile analysis, and you can equilibrate their bite back down to a full posterior and anterior contact point. But I would say it's absolutely fine. Again, going back to how many appliances have been placed worldwide, and the very, very minimum cases where some people may be prone to get rid of this muscle hyperactivity and elongate the lateral pterygoid, to me, it is not a concern of the pros versus the cons with the appliance. So to further discuss those last myths about anterior open bite or adverse reactions, there's been an article, a survey, that appeared in the Journal of Headache and Pain, and it was a survey of 600 dentists and reported over 90,000 appliances placed. And with those appliances, there's been only approximately 1% of anterior open bites reported, and again, 0.3% of potential aspirations, none of which were confirmed radiographically. So, you have this survey that's out there. So it's published in a reputable medical journal, and it reports, basically the unfounded myths that surround the NTI. So in conclusion, I would look at it like if you have a patient who comes to your office who is a patient who suffers from migraines, headaches, if you're looking for the go-to protective appliance for your anterior reconstructions, even a full mouth reconstruction where you might want to use double sliders, I would really consider using the NTI. I would consider yourself to not listen to people who are pontificating regarding myths and unsubstantiated claims surrounding the NTI. And I would tell you to do your own homework, look at what's out there, and just think to yourself the things that I've discussed with you today regarding cut down on muscle function and muscle hyperactivity, regarding decreasing the temporalis and masseter's ability to fire, in a static clench. I would look at what is your standard of care in your practice and how can the NTI fit your practice today and how could it benefit your patients tomorrow.